Amidst the crowd of new arrivals, the nurse notices Mahmoud. The young boy and his family have fled the drought and violence back home in Somalia. He is suffering from malnutrition and has Kala Azar. Alongside Mahmoud's family, tens of thousands of Somalis wait, hoping to be admitted to one of the 3 camps that form Dadaab in northeastern Kenya.
The present situation of the camp, I can describe it as a humanitarian emergency, with the fact that large number of people living outside of the camp with no proper security, no proper shelter, no adequate water, no sanitation, and with no clear future whether they are staying here or will be moved to another place.
Despite the urgent needs, humanitarian aid is still too slow. Refugees have to wait a long time before being registered and accessing regular food rations. The war wounded frequently arrive with life-threatening injuries and are therefore given priority in Misrata's hospitals. But they are not the only ones in need of care. Other war victims, children, women, and people with chronic conditions have all been sidelined by the overwhelmed healthcare system.
As MSF, I think we have a very important role in identifying the most neglected populations, the most vulnerable populations, and populations who've been, whose services or health access has been underserved during the war.
In addition to its surgical programs, MSF focuses on mental health care, training local psychologists, as well as maternal and pediatric care. In order to provide such care, nurses and midwives have had to be replaced, as most of them were foreigners and have fled the country. Medical students are receiving on-the-job training. Nearly 4,000 Africans remain stranded here in camps like Shusha. Poverty and lack of stability in their countries of origin are preventing Somalis, Eritreans, Ethiopians, and Sudanese from returning home. In Shusha camp, MSF is providing medical and psychological care.
In Libya, they go into this sort of detention center where a lot of people get tortured, so that aggravates their sense of mental condition. Arriving in Tunisia, hoping that this is sort of the international community would help them out, and instead they are sort of arriving in a camp where there are a basic lack of facilities.
They've already put their lives in danger leaving Libya. The violence and poor living conditions in the camps, together with the waiting and lack of perspectives for the future, are pushing many of them to embark on another life-threatening journey. Salim is from Yemen. He was shot in the leg during a demonstration in 2009.
I came to Amman in November 2009. I had an external fixator on my leg and the bone got badly infected. The surgical team managed to stop the infection. I was operated twice and they installed a new fixator. Then I began to feel much better.
The program offers treatment to people wounded in unstable countries where there is limited access to care. Nearly 1,500 wounded have received treatment in Amman over the past 5 years. Most come from Iraq, but some are from Palestine and Yemen. Soon, they could be coming from Libya. They are often complex cases requiring several operations before starting physiotherapy. This is a wheel hospital in northern Bahr el Ghazal, a state with one of the highest infant mortality rates in the world. The situation improved in 2008 when a team of surgeons and midwives were sent here, but poverty continues to threaten the lives of young mothers and their children.
It's very common for a woman under 30 to have 7 or 8 children. And of course, frequent pregnancies, you're going to statistically get more miscarriages. The women here work very hard. Life's a bit of a struggle.
Mother and child health care is just one of the challenges facing the young nation. Diseases such as malaria, malnutrition, Kala-Azar, and cholera are rife here. Yet the country is desperately lacking in healthcare infrastructure and skilled health workers. There are approximately 100 nurses and about as many doctors for a population of 8 million. The Ministry of Health estimates it will take at least 20 years to train the number of health workers required.
Y esperamos 10 minutos.
Hay una en la tarde, una MOSI, una en la mañana y una en la tarde.
Every day, Miguel has to take 6 different drugs. He has tuberculosis and lives in Buenaventura. The prevalence here is 4 times greater than elsewhere in the country. Poverty and failings in the healthcare system are partially responsible. The National TB Control Program struggles to provide treatment to drug-resistant patients, despite the fact that they account for 1/3 of cases.
Four treatments have failed. The most difficult part was accessing treatment. I got it too late, by which time I had built up resistance to the first-line drugs.
Since the end of 2010, MSF has been providing technical support to the national program. The medical team's objectives are to improve diagnosis and follow-up of patients resistant to first-line treatments.